together who are going to talk about their experiences with identifying health inequalities.
Sorry, I'm just trying to share my screen. There we are. Sorry, I just need to.
Perfect. Yeah, very good.
Slides. There we go. Sorry. Hang on. It's gone to the end of the slide. Sorry, I'll need to change it around. My apologies. How do I go back on the slides from the share? I do apologize.
I think you just change them as you would normally, actually, just with the arrows in the bottom of right of your laptop.
Yeah, that doesn't stop showing on.
Oh yes, that's good. That's good. Now you've changed slide at least.
Okay, that's fine. Sorry, how my screen's gone completely wrong now. I do apologize.
That's all right. You're on a screen that says rising family costs. We have information to help. A lovely looking poster.
Okay, my apologies. That's not. I'll unshare. How do I unstop share? And then I'll redo the whole lot. I do apologize. So basically, it's a very brief presentation on a project that's still ongoing and was originally started by, there we go. Should be okay to share again. Okay, it should come up. So
Perfect.
it's basically a project on the cost of living. And I know lots of people have done work on that, and it's been really interesting listening into lots of different ideas and lots of different ways of doing it. So Bithik is a foundation trainee who very kindly led the project. Catherine is one of my community colleagues, but there's been lots of different people involved, from community services, GPs, health visitors, play specialists, acute care nurses who have helped with the project.
Marion, can you make it full screen actually?
Yeah, my computer's playing up and I do apologize.
No, don't worry. If you can't, no big deal. Just carry on. It's not a big deal.
It doesn't allow me to move forward even. So I do apologize. There we go. So that's just sort of our, hang on. And it does, if I do that, it doesn't allow me to go back. There we go. I do apologize. So that's just our health board, and it's just sort of to show that across our health board, many areas score among the highest level of deprivation. We cover Blenheim, Gwent, Newport, Torrine, Caerphilly, and Monmouth. And you can see that 4 out of the 5 areas of our health board have got very high levels of deprivation. As you're probably aware, Wales itself has got the highest rate of poverty across the UK. So we've got a huge population, about 30, in some areas up to 50% of the population, who live in relative or absolute poverty. So our first, and as you all know, it's got a direct impact on health outcomes with a higher prevalence of chronic diseases, a higher rate of obesity, and higher rate of negative outcomes. My colleague, Catherine, has did a survey of her community service and found that about 44% of the staff, this is physio, OTs, healthcare support workers, nurses, and doctors, experience child poverty weekly in their clinical practice, with 2/3 of them not being aware of services available, and 90% saying that it would be really helpful to know which resources you can link families up to. So our first step was to collect all the information on charities, support services available, which was a lot of work ringing around health visitors, local charities, local resources, identifying food banks, housing support, financial advice, Welsh Government advice levels, and putting it all together on one website to make it available for people. We also then discussed with families and young people, both in the acute service, in clinics, in parent support groups, how would you like us to link you up with the information? How would you like us to approach it? And the feedback we had is, we'd like to know about it, but when we come in for an acute medical problem, it's not something we want to talk about at the time. We'd rather it being the information being available, but not being part of our initial meeting with healthcare. We've also linked up with GPs, health system midwives, A&E staff, and I have to recommend place specialists as particularly useful for advocates, as they spend time with the families outside of the acute event and have a bit more time. So we've identified 2 place specialists as poverty champions in our acute service, linked up with school nurses in schools, and also with Children in Wales, which is a national group, to look at ways of identifying children and young people and families and linking them up with information and help and support available. Our IT team kindly did us a poster, which we distributed across all GP surgeries, all acute services, all clinics, and we've also managed to get our IT service kindly also arranged for it to be shown on Newport buses and other bus services across the area. And you can see it's in Welsh as required in Wales. It's an ongoing work, so we're still working on ways of implementing a poverty screening tool or to be used as part of our admission paperwork and part of our everyday practice in the acute service, A&E admissions unit, and how we can integrate it into everybody's mindset to find out if people could do with extra support, extra help, with transport, and with all the other aspects of living. I've already mentioned the survey we've done, how parents would like to be linked to the information. I've mentioned the poster we put up everywhere. And it's an ongoing program of teaching, introduction of the resource to A&E staff, clinic staff, primary care and acute care teams, so they're aware of the information and that we use it as an everyday tool to link family to support available. For example, I've used it recently for a child with asthma living in very poor housing conditions, giving them a link to various websites from the Welsh Government and other resources to raise the issue and get help and support. The next step really is to identify issues which stop families accessing healthcare and working on more equality, get more feedback from families and children on how our service needs to adapt, change, and make it more accessible for people struggling. One thing we've been recently talking about is we need to look at children who don't come to clinic. Why don't they? Because we sometimes suspect it might be because they haven't got the resource to make their way to a clinic. Is there ways we can link them to transport services and other ways? Right.
I'm really proud of Carol.
Sorry. So it's a work in progress, and I've had lots of good ideas from today's meeting. Thank you very much.